Hi, I'm Christy Soriano, and I'm the Community Planning Specialist for Somerset County Office of Youth Services. The Children's Interagency Coordinating Council, known as the CIAC, have put together a presentation that will describe free community resources for youth and families who are experiencing emotional and behavioral health challenges, intellectual or developmental disabilities, or substance use. We will present this information in 3 parts. Part 1 will feature county resources, including the Family Crisis Intervention Unit, Juvenile Institutional Services, and Psychiatric Emergency Screening Services. Part 2 will describe the New Jersey Children's System of Care resources, including Mobile Response and Stabilization Services, the Care Management Organization, and the Family Support Organization. Part 3 will highlight state resources, including the Division of Child Protection and Permanency and the McKinney Vento Education for Homeless Children and Youth program. Here you will see a list of county resources, including the Family Crisis Intervention Unit, Juvenile Institutional Services, and Psychiatric Emergency Screening Services. Here to start off Part 1 is Marla Matthews, Executive Director of the Family Crisis Intervention Unit.
Hi, everyone. Thank you for joining us for this session. Next slide. On this slide, you can see a very handy list of the 4 major services available to all youth and families in Somerset County for crisis services. These are all available 24 hours a day, 7 days a week. And you can call any of them and we will help direct you to the right one. If it is not exactly appropriate, we all work together, and you're going to be hearing from each of these services today as well. Next slide. The state of New Jersey defines a juvenile family crisis as being any kind of thing that poses a severe threat to the well-being and safety of a juvenile, or a serious conflict between a parent or guardian and a juvenile regarding rules of conduct in the home, any unauthorized absence by a juvenile for more than 24 hours, otherwise known as runaway behavior, a pattern of repeated unauthorized absences from school, such that it would be defined as truancy, and or any sex trafficking of youth. All of these issues are issues that the Family Crisis Intervention Unit, or FCIU, are charged with handling. Next slide, please. The FCIU operates 24 hours a day, 7 days a week. We are one of those crisis services. Most of our services are typically conducted in our office in Somerville, but due to COVID-19, we are now really just doing telephonic or telehealth appointment, but surely that will be changing sometime. And if need be, we do utilize community response, such as when a family has no other mode of transportation. We provide a variety of services, including assessment, short-term family treatment, case management and referral. And if all else fails, all has been exhausted and a crisis continues to exist, we can seek help with the court and petition the court to intervene. Next slide, please. Anyone can make a referral to the FCIU. The only criteria is that the youth resides in Somerset County, resides with his or her parent or guardian, and that he or she is under the age of 18. Referrals should be either faxed to us or called in, as email is not secure. Our office hours are Monday through Thursday, we're up until 8 p.m. and Fridays until 4:30 p.m. And as I said, we have 24/7 crisis response. So if there is a crisis, you can access us by telephone. And I have that number there. Bridgeway PESS handles our after hours calls, and you're going to hear more about them later on. Also on this slide, you'll see our phone number and our fax number. Thank you very much for your time.
Hi, my name is Gail Kaufman, and I'm from the Somerset County Office of Juvenile Institutional Services. We work predominantly with court-involved and at-risk youth. It's important to understand that juvenile justice system's primary goals are to help youth and families address any issues that might have led to the delinquent behavior and to provide consequences that promote rehabilitation while keeping in mind the safety of the community. For that reason, juvenile delinquency matters are handled in the family court, not the criminal court. The juvenile court places strong emphasis on accountability, but we know that most kids and teens who receive relevant community-based support services eventually outgrow the delinquent behavior. Involvement in the juvenile court, and particularly in juvenile detention, can often expose youth to new ideas and new friends that we don't want them to have, so we try to avoid that whenever possible. This slide provides a basic overview of how someone under the age of 18 becomes involved in the juvenile justice system. The information presented here is specific to Somerset County, since practices may vary from county to county and definitely vary from state to state. For youth who have committed low-level offenses and don't have a significant history of police contacts, the police officer has the option of imposing a station house adjustment, which usually requires the child or teen to do some community service and attend a few sessions with their parent or guardian at the Family Crisis Intervention Unit, which you just heard about from Marla. If they complete those conditions, the matter never gets referred to the juvenile court. However, if the charge is more serious or if the youth has a history of police or court involvement, the complaint would be referred to the prosecutor's office for screening. At that point, the complaint may be filed but still diverted away from the juvenile court to a community-based program that provides consequences and accountability, along with support services to help that child or teen get back on track. If they successfully complete the period of diversion without getting in any additional trouble, the juvenile complaint gets dismissed. And finally, for more serious offenses or for chronic delinquency issues, the complaint can be referred to the juvenile court, which may involve the youth's placement in a secure detention facility and/or supervision by a juvenile probation officer. This slide gives an overview of the 7 programs run by the Office of Juvenile Institutional Services. We oversee juvenile detention and act as a liaison between the juvenile court and the detention facility, and also provide case management and linkage to support services for remanded youth. Somerset County, like most counties in New Jersey, has reduced its detention population so significantly over the last 10 to 20 years that we don't maintain our own facility, so we contract for beds at the Middlesex County Juvenile Detention Center in North Brunswick. We also have several community-based programs for court-involved youth in both Somerset and Hunterdon counties. On the bottom left is our intensive case management program, which provides one-on-one advocacy and linkage to support services for any child or teen who has been formally charged with an offense, including youth who are returning to the community after a period of long-term incarceration. In the middle column, you'll see our 2 alternative to detention programs, the Advanced House Arrest and Home Detention programs, which provide in-home monitoring and supervision. The Home Detention program, which involves a more intense level of supervision, also provides youth and families with intensive case management to help them problem solve through barriers and work towards compliance with the court's expectations. Only a superior court judge can refer youth to these 2 programs. Our office also provides prevention programs for youth who are at risk of becoming involved in the juvenile justice system. In the right column at the top, you'll see the Fire Watch program. This program is not restricted to court-involved youth. Any child or teen in Somerset, Hunterdon, or Warren County who might have used fire inappropriately or who may have unhealthy attitudes about fire can be referred for an intensive risk assessment. JIS staff are certified by the New Jersey Division of Fire Safety to conduct comprehensive child fire setter risk assessments. After determining their risk level, we then help the youth and family connect to appropriate educational and support services. Studies have shown that more than 80% of youth who participate in programs such as ours never engage in dangerous or unhealthy use of fire afterwards. Anyone can make a referral. Below that is the Advanced Station House Adjustment Program. Youth who have completed a station house adjustment previously and were later charged with another low-level offense may be referred to this program for one-on-one intervention that is tailored to their specific needs. Referrals are made by the police department to the Middle Earth program in Bridgewater, and the screener from Middle Earth then determines whether to escalate the referral to the Advanced Station House Adjustment Program. And finally, at the bottom, you'll see the question and answer line. This warm line is designed to help parents, guardians, and other concerned adults understand how to navigate the court or behavioral health systems when a minor has a police contact or is engaging in risky behavior. Callers can leave a message and we'll call back within 24 hours to get more information about their specific concerns and help them figure out next steps. Callers are not required to provide any identifying information, and messages can be left 24 hours a day, 7 days a week. All of the information, all of the programs in our office are free to the public.
Hello, thank you so much for joining us. My name is Sally Andrews, and I'm a clinical supervisor at Bridgeway PESS, Somerset County's Psychiatric Emergency Screening Services Center. While we serve both adults and youth, we will focus on youth for this presentation. We are located at 282 East Main Street in Somerville, New Jersey. We operate 24 hours per day, 365 days per year. We can be reached at 908-526-4100 and can deploy for mobile outreach anywhere within Somerset County, 24 hours per day. Next slide, please. PESS's youth services include crisis evaluation, stabilization, and mobile outreach. Youth may be referred by school, law enforcement, community providers, or family. PESS accepts referrals from anyone. However, when a youth is being referred, a parent or guardian must be present for the evaluation of a minor. PESS completes evaluations for individuals at any stage of crisis. A youth may be referred for a variety of reasons, including reports of mood disruption, including depression, anxiety, anger, threats to harm self or others, or reports of harm to self or others, destruction of property, changes in behavior which cause concern. When in doubt, just give us a call and we can assist you through the process to determine if we are the appropriate resource. PESS is currently operating via mobile outreach and telehealth, both via telephone and Zoom at this time due to the pandemic. Please note, when any school is requesting a back to school note, we will require the school to contact our office to provide collateral information. The referring school will be charged $200 for the evaluation. Next slide, please. Bridgeway PESS will provide rapid mobile outreach focused on early intervention, least restrictive crisis intervention, and hospital diversion. We provide a community-based psychiatric emergency screening service center that will include the youth living room model of care for delivery of crisis intervention services, planning, and follow-up appointments. We use flexible follow-up screening service on-site and in vivo to ensure that individuals receive crisis intervention services while awaiting appointments with community providers, or if they miss an appointment and need an additional referral option. Again, if the school refers a youth for an evaluation, the school district will be responsible for a payment of $200. Our COVID-19 update. The PESS living room is temporarily closed. All evaluations will be conducted via mobile outreach or telephone. PESS screeners cannot deploy if persons served or the family in the home are COVID-19 positive. However, alternative services will be recommended. Next slide, please. PESS has adopted the living room model approach to service provision. Our site provides a comfortable, trauma-informed approach to children and adolescents in crisis. This safe space provides crisis support to individuals while avoiding the trauma of the emergency department, which could include long wait times, medical testing, and medical bills. In addition, PESS has direct admission policies with Carrier Clinic and Summit Oaks when hospitalization is needed, which allows further avoidance of the emergency department. Please note some restrictions apply due to the COVID-19 pandemic. And again, due to the pandemic, the PESS living room is currently closed. Evaluations are being completed via mobile outreach or telehealth Zoom. Thank you.
Now we're going to talk about the New Jersey Children's System of Care resources, which include mobile response and stabilization services, the Tri-County Care Management Organization, and the Family Support Organization of Hunterdon, Somerset, and Warren.
Hi, I am Danielle Cromartie-Williams, the Program Director for Mobile Response of Hunterdon, Somerset, and Warren counties. We have offices located in Bridgewater, Flemington, and Phillipsburg. There is a mobile response in every county, so if a youth ever moves and is having difficult time adjusting to new surroundings, they can always access services. Currently, we continue to dispatch in person with PPE, or we can also conduct a dispatch remotely via Zoom or DoxyMe at the family's request due to COVID-19. All services are free of charge, covered under the Children's System of Care for all families. Next slide, please. Mobile Response has crisis intervention specialists that are dispatched to homes, schools, or within the community for any youth that are experiencing increased behavioral and mental health concerns. We can dispatch to youth 0 to 21. Most calls we have seen are for youth 3 to 21. With the 0 to 2 age range, this was a recent change, and we are then able to open up with the family to case manage with parents as needed and link them to appropriate supports. During transition periods, we have had youth 18 and older call on their own as well. We can arrive within 1 hour or up to 24 hours at the family's request, such as if a parent would like the dispatch to occur after work or school hours, that's fine. Our goal is to stabilize the concerns. Our CIS spend about an hour with the family to assess needs. Our CIS meet with the family together as a whole, and then they use separate to ensure that all parties are being heard and to obtain that youth's voice and goals. We can link the family to informal and formal supports. Formal being linkage to an intensive in-home clinician and possibly a behavioral assistant as needed that will come meet with the family for about 2.5 hours per week for 8 weeks. Informal supports meaning linkage to community resources, neighbors, church groups, or youth activities. We continue to check in with that family weekly for support during these 8 weeks. We can also refer to CMO as needed if behaviors rise to that level, which you will hear more about from my colleague at CMO. We currently have bilingual crisis intervention specialists as well that speak Spanish and Hindi. Next slide. We are available 24 hours a day and can be called at any time. We always have someone on call to respond along with an on-call clinical supervisor. You can access mobile response by calling Perform Care 1-877-652-7624. Schools, community partners, and other referral resources can always call with parents for assistance and support, and to ensure that the proper consent is in place. We do ask that the parent is present for dispatch to sign off on the paperwork as well. Next slide. On this next slide, please see some examples from recent dispatches that have occurred in our areas. As you can see, some common calls we receive have been for depression, anxiety, and school-related concerns. There have also been calls related to substance use, family illness, and multiple other concerns, as each family is unique and have the right to define their own crisis. As needed, we can also refer to PESS for psychiatric screening if a youth has more intense concerns upon meeting them, such as if a youth becomes homicidal or has a suicidal plan. We also refer to FCIU for any truancy or serious family concerns. We would like to continue building upon school and community relationships and would like to understand some of the concerns you have experienced as well. So please feel free to reach out. Thank you.
Hello, my name is Amanda O'Neill, and I'm the Community Resource Specialist at Tri-County Care Management Organization under the direction of Linda Zimmerman in our Community Resource Department. Next slide, please. We are a nonprofit care management organization for youth aged 5 to 21 in Hunterdon, Somerset, and Warren counties. At Tri-County CMO, we implore best practices so that all youth with complex behavioral, developmental, or addiction challenges have access to tailored, comprehensive, formal and informal resources. Upon referral through a Perform Care authorization, we provide intensive care management services from the date of enrollment to a well-developed transition plan. We work to build strength-based, individualized services plans that are child-centered and are family team driven. We help develop a wraparound care plan comprised of child, family, and community strengths, forming a child-family team. We work to engage the child-family team in ongoing identification and development of sustainable community resources while enhancing the family's choice, voice, and independence. Care managers, with support from their supervisors, ensure that services identified for the child-family team are community-based, culturally competent, responsibly authorized, delivered and monitored for electronic health record system, managed with documented outcomes. We are HIPAA compliant. As much as possible, these services are authorized without waiting lists or eligibility barriers. At Tri-County CMO, we also serve as an information resource accessible to the community at large through our online resource net, offering a community warm line and an informational email address. Next slide, please. Right about now, you might be asking, what exactly does this look like? It's important to note that our care management staff and authorized services are being delivered to youth and families in person, in home by care manager, and in person, in home, and or use of telehealth, video conferencing, and phone contact by providers. So each youth has an individual service plan comprised of the family vision, needs, strategies, identification of formal and informal services and supports. And ISPs contain services that will support mental health, emotional, behavioral challenges, substance use challenges, developmental or intellectual disability challenges, which are all identified through that initial referral and assessment process. Next slide, please. The types of services we offer include intensive and community, behavioral assistance, intensive outpatient services, mentoring and psychological and or psychiatric evaluations, and out-of-home treatment options when in-home and in-community do not meet the youth's current level of need. Licensed clinical alcohol and drug counselors are available, along with substance abuse evaluations and other treatment options for youth that are facing substance abuse challenges. We can support families with the developmental disability application process, identify family support services such as respite and camp options, and authorize intensive in-home therapeutic and clinical services. We're proud to provide bilingual support and care management, as well as the ability to connect with bilingual community providers and resources. Each county has a family success center, and we encourage connections to our families to participate in their free activities and services they provide. Here in Somerset County is the Pioneer Family Success Center. The added guidance of a family support partner through the Family Support Organization is offered to all of our enrolled families. Family Support Organization offers opportunities for youth participation in the youth partnership, as well as caregiver support groups, which you'll hear more about. Linkages to basic needs, resources, and support, such as housing, utility, food, and clothing can also be identified. Engaging our wraparound care model, as illustrated, allows us to serve youth and families in their homes and communities. We collaborate with our system partners, our schools, and our community-based providers in joining our services and strengths in keeping families strong. Our last slide, please. As you can see, our final slide illustrates all our contact information and links, the location of our 2 offices, the social media platforms we employ to promote our events and quarterly newsletter, information to access Perform Care, and our warm line. In closing, we offer community training opportunities to professionals, caregivers, and youth on the Nurtured Heart approach. And for more information about that, you can contact Stephanie Soriani, our program manager. Thank you.
Good afternoon, everyone. My name is Penelope Griffin, and I am a community outreach specialist with the Family Support Organization of Hunterdon, Somerset, and Warren County. The mission of the Family Support Organization is to ensure that families of children with emotional, behavioral, intellectual, developmental, or substance use needs are provided a community-based, compassionate, and culturally competent support system that will provide ongoing family-oriented support, information, education, and advocacy. Next. So our goals are to educate our families on their rights and responsibilities within the New Jersey Children's System of Care that will strengthen the family so they can be their own best advocate. So when a youth is enrolled with care management organization services, the parent is eligible for one-on-one peer support. So with that support comes the family support partner. And a family support partner, as I mentioned earlier, is someone involved with the children's system of care with their own child. Family support partners work to empower parents and caregivers to become their own best advocate. They provide resources based on the needs of their families they serve. And they also encourage parents and caregivers to attend our support groups and workshops. So really, they are the catalyst of what FSO HSW is and what we aim to serve in the community. Next slide, please. However, our outreach initiatives here do not stop at just families who are enrolled in CMO services. Our services are open to families everywhere, the entire public. So we do that in a few ways. We do provide educational workshops each and every month. And those subjects include IEPs, trust, school continuation, mental health first aid, substance use disorder issues, mindfulness, ADHD issues, and so much more. So we do provide a really large scope of services for webinars and workshops. This also includes the Nurtured Heart approach, and we provide that in English and Spanish as well. We also have a youth partnership program for youth ages 13 through 21. This is supervised, peer-led. It encourages social interaction and discussion, and it also encourages our youth to do volunteering and service. And of course, we have our caregiver and parent support groups that are also open to the public. They provide social interaction, discussion, resource sharing. We offer those weekly in English and in Spanish. And right now we do have a pretty good group in both of those capacities. So we do encourage you to inform all of the families that you serve to contact us to utilize our support groups and workshops. Everything we're doing right now is virtual. We're hopeful to get back in person soon, but until that time comes, we are providing everything virtually to make it more accommodatable for our families. And we also do our agency partner presentations by request. So if you have another group that you want to do a private discussion with, overview FSO services, do a Nurtured Heart, we'll be more than happy to organize and orchestrate that for you. And you could do that by calling our warm line at 908-223-1191. That's Monday through Friday from 9 to 5. And I thank you again for coming out today and listening to this presentation. And I hope you can utilize our services. Thank you.
On the screen, you will see a list of state resources, including the Division of Child Protection and Permanency and the McKinney Vento Education for Homeless Children and Youth program.
Hi, everyone. My name is Michelle Dufour, Community Liaison and Resource Development Specialist for the Division of Child Protection and Permanency, DCP&P, Somerset Local Office. Our physical office location is in Somerville, though we travel and cover the entire county. I have worked for the division for 13 years in varying roles, including intake, permanency, supervision, emergency response, and resource development. Every county in the state has at least one DCP&P office, and there's a community liaison in each. If you know someone in another county who would benefit from education from DCP&P, please have that person reach out to the local office and ask for the resource development specialist. If you have questions moving forward or are having difficulty reaching a DCP&P worker who is involved with one of your youth, please feel free to reach out to me. I have been working from home for the most part, so the best way to reach me is via cell phone or email as noted on the slide. Next slide. The Division of Child Protection and Permanency, DCP&P, formerly known as DIFUS, is an agency that is mostly known as one that investigates abuse and neglect allegations regarding children. Despite what you may have heard in the community, our goal is not to remove children from their homes, but instead to keep families together. We try, if at all possible, to stabilize families in home by providing families with wraparound services to assist with whatever needs the parents and children have. At any given time, DCP&P is involved with 500 to 600 children in Somerset County. As of February 2021, of all those children, there are only 48 in out-of-home placement. I note this to show you that we are dedicated to do whatever we can to try to ensure that children are safe, happy, and healthy in their homes with their family of origin. DCP&P investigates allegations of abuse and neglect and also conducts child welfare assessments. These assessments are referrals where there is no allegation of abuse or neglect, but there is some need indicated for the family. These referrals are voluntary and the division cannot mandate the family's involvement with us. In case you didn't know, every person in New Jersey is a mandated reporter, not just the police, schools, and medical personnel. For DCP&P purposes, the definition of abuse and neglect is the physical or mental injury, sexual abuse, or negligent treatment of a child by a person responsible for that child's welfare. This means the omission, commission, or both of an act which allows a child to be placed at substantial risk of harm. I'd like to note that DCP&P investigates allegations of abuse and neglect by parents and caregivers. There is another agency under the umbrella of the Department of Children and Families called the Institutional Abuse and Investigation Unit, IAIU. Their job is to investigate allegations of abuse or neglect onto children by other people responsible for their welfare, such as teachers, residential home staff, and daycare staff. You can refer to IAIU by calling the same state hotline. Next slide. The state central registry, known as SCR, is the hotline number for the whole state. It's available 24 hours a day, 7 days a week. After you make a call, the SCR worker will give you the disposition prior to ending the call, so you'll know what time frames the DCP&P worker will need to make contact with the family. This could be an immediate response time, one within 24 hours, or for child welfare referrals within 72 hours. There are emergency response workers available for weeknights, weekends, and holidays to ensure someone is always available to assess the safety and well-being of children. DCP&P workers have been working from home for the most part since March 2020, though we never stopped responding in person as needed. Field staff continues to respond to referrals and home visits in the field with appropriate PPE. Paperwork and follow-up ongoing calls are being conducted remotely. Every DCP&P worker has a state-issued cell phone and is reachable by that phone and by email. For investigations, the local office nearest where the mother resides is assigned the referral for follow-up. Investigators interview in this order, if at all possible: the referent, alleged child victim, siblings, non-offending parent, and the alleged perpetrator last. The responses are for the most part unannounced, as we try to see people in their real element without time to prepare responses or make adjustments to the home. The order of interview changes slightly for domestic violence allegations, where workers are allowed to contact the non-offending parent first to arrange a safe time to meet with that person and his or her children. Next slide. DCP&P is allowed to interview children alone at their home or in the school setting without parental consent for Child Protective Service referrals. The child and the parents have a right to privacy and confidentiality. There was guidance issued to all school districts from the DCF Attorney's Office stating that if at all possible to allow these interviews to happen in private. Please reach out to me individually if you have questions or concerns about this. DCP&P is allowed to obtain records for the child under DCP&P investigation without a court order or consent. So please do return those collateral requests that the workers send to the school looking for information. You are allowed to provide school records, IEP, and child study team documents, and you are protected by Title IX in releasing that information. As part of our investigation, workers will do risk assessments and safety assessments. Risk assesses the likelihood of harm in the future, while safety assesses the likelihood of harm in the immediate. If there is an immediate safety issue that cannot be remediated by a safety protection plan, where someone is available to supervise the offending parent, then DCP&P has the right to remove that child to place them with a relative or unrelated resource parent. That being said, DCP&P will then stand in front of a judge with a division attorney 2 business days later to defend their reason for removal and explain why that child could not be kept safe in their home. There are many levels of oversight in decision-making for child placements. Most families remain open in the investigation stage for up to 2 months. We have up to 60 days to speak with everyone involved and to come up with a finding of either unfounded, not established, established, or substantiated. Sometimes that can be extended if we are waiting on a report or further information to determine if abuse or neglect occurred. Most cases are closed out at the investigation level. Anything that stays open beyond that gets assigned to a permanency worker for ongoing case management. Those families are then open either voluntarily or under a court order. Thank you for taking the time to listen to me today. Please reach out to me if you have any further questions or concerns.
Hello, my name is Diane DiRuggiero, and I'm the Regional Director for the Stewart B. McKinney Vento Act. I serve 6 counties in the state that cover Bergen, Hunterdon, Passaic, Somerset, and Warren counties. Next slide, please. The McKinney-Vento National Homeless Assistance Act works with displaced families and unaccompanied youth within the community for any child or youth that is experiencing homelessness. The primary focus of this act is to keep students in school. All services are free of charge, as each school district has a liaison that covers the district. And as you can see, for Title I Part A schools, the services listed below can be paid for using those funds. And if it is a school without Title I Part A, they would use general funds. All these services are allowable under McKinney-Vento for homeless youth and children. Next slide, please. Eligibility, as you can see, it says that they define homeless children as individuals who lack a fixed, regular, and adequate nighttime residence. The difference is, although the residence may be regular where the student is going there night after night, it's not fixed. It would be considered temporary in the example of if a family had economic issues and they had their home foreclosed upon. They moved in with family or friends temporarily until they can get back on their feet, and that would be considered doubling up. Now, I want you to keep one thing in mind, is that the HUD definition of doubling up does not mean homeless, but under McKinney-Vento, it does. And that allows the student to remain in the last district of origin. And we will get into that in the next slide. Next slide, please. Displaced by every law, New Jersey school districts must have a McKinney-Vento liaison who is responsible for assisting displaced students. And again, a student that is displaced, that's no longer living in their permanent residence, can still return to their last district of origin or remain in the district of temporary domicile. So they can enroll in either school district. And again, here is a list for McKinney-Vento liaisons in New Jersey. I just want to mention as well, for transportation, that would also be arranged by the liaisons. So the student, if they were to in fact attend the last district of origin, they can be bused back. If it's a walking district, then the student would not be offered transportation. So I would reach out to the liaison if you do have a student that's coming in claiming McKinney-Vento displacement. Next slide, please. And I'm going to give it back to Christy Soriano, our kayak lead.
That concludes our presentation. We are here to support you and your family in any way that we can, so please feel free to reach out. If you're not sure which agency to contact, feel free to reach out to anyone you heard from today, and we will be sure to help link you to the appropriate resource. Everyone's agency and contact information can be found on the screen. Thank you so much.